Good afternoon. Yesterday, the Emergencies Council met to review the island's current public health position, the management of COVID-19 cases, and the continued impact of our vaccination programme and safer travel policy. So today, the Deputy Chief Minister will set out a simplification of that safer travel policy to provide additional clarity for visitors and islanders returning to Jersey, especially returning university students, and to bring the policy closer in line with our management of direct contacts. Now, before he does so, I want to provide an update on the management of the virus and to address the current trends we are seeing. Now, I know that there are some islanders who will be feeling an increased level of concern as we ease restrictions and return to normality, especially those who are most vulnerable to the impacts of COVID-19. And those islanders are foremost in our minds, and we are continuing to review and update our guidance for vulnerable people as the shape of the pandemic changes, both locally and internationally. Now, over the past week, we've seen a marked increase in the number of positive COVID cases in Jersey. And in previous waves, this would have been a cause for alarm, and many islanders would have asked if a lockdown is imminent. And I want to reassure you that the circumstances are very different this time, and we are not locking down or announcing enhanced restrictions. At present, we remain in a good position, and this view is reflected by Dr. Muscat, by his medical colleagues, and by public health officials. And this is because of the continued success of our vaccination programme, our testing regime, and the vigilance of islanders. And this is not a blind reassurance. We continue to monitor the position in our community very, very closely. Our testing rate remains significantly higher than other countries, including the United Kingdom, and hopefully you can see on the graph in front of us. Where they are testing, the UK is testing on average 10,000 cases per 100,000 each week, and that includes lateral flow tests. We are testing 17,500 with PCR tests alone. When you add in our lateral flow tests, we are testing at a rate almost double that of the UK. And that means that we will naturally find more cases because of the volume of tests being undertaken. Where we are seeing a rise in active cases, these are predominantly amongst those aged 12 to 30 years old. And amongst this demographic, the effects of COVID are significantly less severe. When we compare case positivity against the previous wave in December 2020, you will see that positivity among the older, double vaccinated, has significantly reduced. And that's the darker lines on the bottom, on the right-hand side of that graph. Among those over 40, it is less than 2%. And in those aged over 60, it is less than 1%. And this shows that the vaccination programme is working, and that it was targeted correctly to protect those most at risk. So as of today, 82% of those aged over 18 have had a first dose of the vaccine, and over 63% have received a second dose. But importantly, 94% of those aged 50 or over have now received their second dose. Most critically, hospitalisation remains low at present. Less than 0.5% of recorded COVID cases are resulting in a patient being admitted to the general hospital. Now, of course, we want to keep this number as low as possible, and I'll send our best wishes to anyone who is being treated for COVID-19 and to their families. Over the coming days and weeks, as we return to normality and live with COVID, we will continue to monitor the situation on Ireland and provide islanders with updates on our situation. I'm now going to hand over to Centre for Lyndon Farnham, the Deputy Chief Minister, to obviously go into further detail on the travel side. Lyndon.
Thank you, John. We are in a very good place thanks to the remarkable combination of hard work of all of the teams in vaccination, testing, contact tracing, and of course, our wider health services. At the weekend, we said we would be asking officials to review the safer travel policy in light of the changes we were making to the isolation requirements for direct contacts. The current positivity rate for arrivals at the borders is far lower than for direct contacts on island. So we need to amend our approach. We need to provide certainty for the younger age groups who have not yet been able to obtain full vaccination, including our university students and younger family members returning to the island. We need to provide clarity for our transport partners and our visitors, and we need to provide reassurances for local businesses to protect livelihoods. As our vaccination coverage continues to grow, we need also to ensure that our policies reflect the progress we are seeing. With the increased protection afforded to islanders, it is important that we do not allow the restrictions to become more harmful to our well-being than the virus itself. So from Tuesday the 13th of July, that's next Tuesday, the safer travel policy will be updated to make things simpler for islanders and for visitors. Countries and regions will no longer be assessed based on a traffic light system. Travellers will no longer need to declare their 10-day travel history, and instead testing and isolation requirements will be based on vaccination status. So travellers who are fully vaccinated will only be required to undergo one test on arrival and will not be required to isolate. Passengers who are not fully vaccinated will need to be tested on arrival and on day 8 and will need to isolate until their first day 0 negative test result is received. There is one exception to this rule currently. Anyone who arrives from the UK government's international restricted list will have to isolate for 10 days. It's absolutely critical that we all continue the enhanced hygiene habits that have become second nature to us. Keep sanitising our hands, keep distance from people outside of our household, and if you have any symptoms, stay home and call the coronavirus helpline. In the meantime, I'd like to thank every single islander for their continued support and cooperation. So thank you very much, and I'll now hand back to John.
So thank you, Lyndon. The changes to the safer travel policy are another positive step in our returning to normality. And it is a new normal, where COVID is very much a part of our lives, present but manageable. And we will continue to keep in mind our overarching objectives of protecting those most at risk and ensuring the continuity of our health service. And we are always mindful that we might need to act if the situation changes suddenly. Ministers have already asked officials to review policies to ensure that if we consider there will be a significant impact on health services or a rise in cases amongst our older and vulnerable population, that contingency plans are in place to act and protect islanders. Now this weekend, many islanders will be glued to the Euro 2020 final as England have the first opportunity in 55 years to take home an international title. If you are watching with friends, I want to encourage you to do so safely. Please watch the match in the open air if you can. Please maintain social distancing, and if you're watching inside a public location, please use the tracking apps and maintain those enhanced hygiene measures. They are there to protect us all. As schools start ending today, Dr. Muska is writing to all children, young people and their teachers. As schools start to end, and today Dr. Muska is writing, I should say, to write to teachers and everyone else, thanking them for courage, hope and understanding during the COVID pandemic. He is right to do so. It has been a challenging period, especially for the youngest in our community. And I echo his thanks to all of our community and staff. We'll now draw a line there and take questions from the media. So, I think in the room we have Gary, and I think online I have got Ed from the JP. Looks like Harry from 103. I can't quite see who's there for Bailiwick or BBC, but we'll get there in a minute. Right, we'll go for Ed in JP and then Gary straight afterwards. Ed.
I can hear you on my phone, but I think you're muted in the live feed, so that'd be helpful if you could unmute yourself, please. Thank you. Yes, so I understand that 3 people are in hospital at the moment who have tested positive for COVID. Are they there because of COVID or for another reason? And what is their vaccination status?
Ivan?
Some of the the numbers are small, as you know, so I would like to protect their privacy, if I may, by not giving exact figures, because they will feel self-referred to, and that's inappropriate. But some of those admitted have been admitted for non-COVID reasons and have been found to be COVID on admission. And some have been vaccinated, some haven't. It's as close as I can get, given the very small numbers that we are talking about. I know you wanted more accurate figures. I appreciate that.
Do you want to go for another question, Ed?
Got a delay on the line, I think.
Yeah. That's the last bit.
Yeah, he's got a time left.
Yes, I'm still struggling to hear you, but I'll persevere. But very simply, do you think there will come a time when COVID is viewed as the same way as flu, and those infected will not need to self-isolate? And when do you think that might be?
I'll go for in principle and hand over to Ivan. I think, without getting dragged into too simplistic comparisons between that, I think that's got to be where we end up at some point, i.e., in my view, when we've got probably as many people as can be humanly vaccinated as is humanly possible, and that we are then moving into that absolutely living with COVID and that new normal. The when is probably slightly different, but Ivan.
Thank you. You're right. That is everyone's ambition, to move to a place where COVID has the same burden, if you like, as flu. But at the moment it doesn't, because it is still a very new virus, relatively speaking. We've had flu, all of us have been exposed to flu in one form or another since we were born. So our immune systems have been exposed to flu over the years. It is, although there are variants of flu, it is not a completely novel virus. This is a completely novel virus. We are slowly getting used to it. Of course, vaccination is helping us hugely in developing sort of the experience of exposure to COVID, and the more the population develops COVID experience in one form or another, the closer we will get to a flu-like relationship with COVID. I cannot tell you when that will be exactly, but we are already palpably one step closer to that, given the weakening of the link between COVID infection and hospitalization due to COVID.
Okay. Right, Gary.
Afternoon all, good to be back. Chief Minister, we had the change of isolation policy for children, then we had the change of isolation policy for direct contacts, then we had red, amber, green going to red and green, and then we had the change of policy if you've been to a red country and what you declare and how long you have to isolate, and now we're changing the isolation rules for the unvaccinated. For some people, it feels like perhaps you're making this up as you go along, and the previous let's wait 2 weeks and see before we do stuff just isn't happening. What's your response to that concern? Because there is that concern out there.
I get the point. Okay, this fundamental point to remember, okay, is, and we are responding as the speed of things are taking place, let's put it that way around, and also we are also responding to the speed of the vaccinations status. I think that's important. If you go back to, I'm going to say June, July and August last year, and I think September as well, we were bringing people into the island with one test and no isolation, with no vaccination. What we're now doing is that if you're fully vaccinated, you will have a test, yes, and you don't need to isolate. But if you haven't been fully vaccinated, you will have to isolate. Admittedly, it's a quicker turnaround, it's the 7 to 9 hours. But basically, that is a stronger regime now in the context of a significant level of vaccination than we were actually running in June, July and August last year. So, and what we've been trying to respond to is, as we've said all the way through, is as initially we had kind of set out our stall, but obviously things did start changing, firstly around us in the United Kingdom and also then in here. That connectivity of what with a lot of people are still reasonably well, if that makes sense, particularly if they've been double vaccinated, and the ability for them to reconnect with their families and the other way around, either in the UK or back or elsewhere. So we have been responding, and we are doing it on the basis of considered. So we're not just waking up one day and saying, can we try this? But we are also recognising that as events go through, and sometimes, originally we were very focused just on what's called the common travel area, which is broadly speaking United Kingdom, but obviously with the Republic of Ireland. And then obviously find you'll get islanders coming through from other jurisdictions where they've been double vaccinated, etc., etc. So we are trying to respond to those change in circumstances as those iterations come through. What we're hoping we've got here is recognising again, shifting away from a focus on red, amber, green, but moving towards vaccinated status or not vaccinated status, and ensuring within all that we hope to get the balance right, protect islanders, but allow that sort of normal life or close to a normal life to resume. The big caveat to recognise is it was referred to as the UK Red List, which did cause some difficulty, but it's essentially countries which are more high risk, shall we say, are categorically carved out of this regime. It is still a full isolation period and 3 tests coming in. So it is, again, as we keep saying, it's around, we believe, balance of risks, and it is also in conjunction, and it's being consistent actually with what we're doing with direct contacts, etc., on island as well.
Dr. Ivan Muscat, I've sent a number of emails to the press office this week to ask for some basic information that I hope would actually help the community and the government in terms of painting a picture of the world we're living in now. And I've been stonewalled on every occasion, unfortunately. Not sure where the blockage is, whether it's management in the hospital or elsewhere. But in essence, can you paint me a picture of the type of disease you are now seeing that causes someone to be hospitalised? Is it less severe than, for example, in December when you had the CPAP machines up and running and so on and so forth? And likewise, paint a picture of what that disease now looks like in the community where someone is positive but doesn't have cause to need hospital care.
The bulk of infection now, as you know, is in the community because it is mild and therefore does not require hospitalisation. And people are managing it in the main as they would a mild respiratory tract infection by another name. So rest, hydration, paracetamol. A small number of people, a significantly smaller number of people, develop more severe disease requiring hospitalization. But even those that require hospitalization have been noted, and this is in the UK where the numbers are much larger and so the data is more robust, to be less severe than we've seen in the first and second wave. So there has been a general reduction in the severity of disease that's being seen. And that reduction is largely driven by vaccination directly, and it is also driven by vaccination indirectly in the sense that the infection is occurring in younger people who have yet to be vaccinated or who are not eligible for vaccination. And as always, COVID is much less severe in the young. So it is much better an illness, in inverted commas, to have now than it was before.
A LEMSIP illness for the young?
If that's the preference.
Thank you both.
Okay. Right, I'm not sure whether online in the media are having slight difficulties hearing from us. Apparently, hopefully we're all back in action. So, I'll go for the BBC, which I think is Alison.
Hi there. I wanted to know whether the decision to change the red, amber and green, getting rid of the traffic lights, was that a decision taken because the school holidays are coming up?
When I say not directly, certainly as far as we're concerned, we have kept an eye on some of our policies around making sure that there will be a change in sometimes demand, particularly if people are fully vaccinated and well, when you get to the summer holidays. But this particular change was actually more about being consistent with the outcomes of the policy that we did in direct contacts, is the way I would put it. It wasn't driven by the fact of the arrival of the school holidays. Do you want to add?
Yeah, if I may, just add a little snippet. So last summer, we did not have vaccination available to us, and the risk stratification was based on the frequency of infection in the country of origin. That was our best approach to it. This time round, we have vaccination on our side and to scale, although the program continues to roll out, of course, and that has allowed us to simplify the travel policy to one based on vaccination. And that is then not going to change very much, I would have thought, as we go forward. Thank you.
There are many people who are clearly going to welcome this decision, but in recent days we've seen a big increase in the number of people being tested through contact tracing. And I understand how these systems may be separate, but are you confident that the testing facilities for arrivals into the island can cope with potentially a big increase?
The short answer is we did discuss that at the meeting yesterday. So we are looking at that. If we need to upscale for example, the testing resource, we will do. As we've said, we have increased the resource within the contact tracing side. That's is being implemented during the course of this week. And as I said, whilst I accept that the system is probably still stabilising, if that makes sense, it is in the process of settling down. It's bear with us, but the improvements are being put into that side of things, including some automation, for example, text messaging, which reduces the impact on manpower and therefore again assist demand. That's the contact side. The testing side, we have had those discussions. If we need to, we will put some additional resource into that, and that's something that's under consideration at the moment. At the moment, the feedback we've got is we're okay, but that's just looking ahead as to whether we need some further resource.
Thank you.
Okay. Right. Harry. 103.
Good afternoon. Sorry if this has been asked before, obviously had the earlier technical issues, but I wanted to ask about obviously the rules with direct contacts you mentioned obviously in the last press conference, but since then we've heard concerns from especially teachers, those who maybe haven't either had their first jab or more likely their second jab yet, who may be concerned that because they're not having to isolate at home with being a direct contact, that they're going into school, and that could add to the risk for them, especially in the lead up to the school holidays, and they don't want to be having to isolate, and them having to isolate could also have an effect on education for them and school children themselves. So have there been discussions with unions, the teachers themselves, to hear their concerns, because they're making them known to the media and others?
So my understanding, I don't know if Ivan wants to add to this, my understanding is that discussions were certainly had with head teachers, as I understood matters. I know there's always reference to stakeholders, which I have to assume it would include the unions. And the reason I say that, because I know the unions have been engaged a lot during the process, and I'm very grateful for all the relationship building that's been happening there. I can't categorically tell you that in the last 3 days there's been engagement there. My assumption is that has been, because there's been engagement all the way, for a long time, all the way through this process. Really to make the point that obviously, given that we've been down to the over 18s have been opened up for vaccination, I think it's for the last 3 weeks. I'm going to look to my right for being corrected there, but it's been open. that very much I would hope that anybody who is feeling slightly exposed from that perspective has gone and got their appointment and got that first vaccine. Obviously, what you're then constrained by, which Ivan I'm sure would like to, will hopefully can comment on, is the gap between that first vaccine and the second vaccine, which, as I understand it, can't easily be speeded up. You know, you can't take it down from whether it's 4, 5, or more weeks down to 1 week for the sake of argument. But Ivan, do you want to comment on that?
Thank you. Yes, indeed, the vaccination has been opened down to the 18-year-olds and above from the 14th of June, three weeks ago, as the Chief Minister said. The older individuals would have received their second dose by now. Younger individuals, as we were saying earlier, are less likely to have significant disease due to COVID, and they're the ones who would by now have had their first dose. And hopefully all of them would have had their first dose, and I would urge anyone who has not had their first dose down to the age of 18 to book to make sure they get vaccinated. And of course, those who've had their first dose will now be coming up to their second dose. The gap, the minimum gap between the first and second dose is 4 weeks. But you do get a better immune response if you increase that to about 5 to 6 weeks, which is what our current gap is. But we most certainly can't reduce it to less than 4 weeks. What is encouraging is that we had hitherto been of the view that the first dose of the current vaccine only provides 30% efficacy against symptoms with Delta. There is now more and more evidence to suggest that that's higher and probably closer to 70%. So those people who have had one dose are in fact in a reasonable place. And I would also add that as with every other vaccine, if it doesn't protect you completely against an infection, it will reduce the severity of the infection. And that holds with the COVID vaccine too. But at the end, the final message is, if those have not been vaccinated, please make an appointment to start the vaccination schedule. And those who are due to have their second dose, keep that appointment.
Yeah. And it goes back to that point, over 63% now of every islander above 18 is now had the second dose. And each week that's improving. So, you know, we are, and particularly with the schools, you know, as I said, some schools are breaking up today, tomorrow type of thing. The rest of them will be the end of next week. So, you know, the time period is very much constrained in terms of the impact on teachers and pupils, and then hopefully we get into summer. Okay. Right. Do you have another question, Harry? Yes. I was
going to say, can I have my second one?
You can.
Thank you very much. Sorry to interrupt. You mentioned in your speech about obviously the final this weekend. I suppose it's probably the last press conference before that game happens. With the rules on events, as I see it, obviously it's the 15th of July until we might see Freedom Day and these big events and festivals and things. And I know there's been talk about, you know, it's the first England final in so long. People want to enjoy it. There's been talk possibly about big screens, and you want to get people together to enjoy it, but maybe in a safe way. Is that something that the government are looking at? Is it a Paris thing, or and you can just kind of an added comment on just what people can do, because obviously it's a big game. You don't want people to, I assume, to get too carried away.
I think so I'll hand over to both Ivan and Lyndon in a sec. As a general principle, in terms of, we're obviously pretty aware of the circumstances. It is a fantastic position. I mean, it's I was about to say it's the first time in my lifetime, but I'd be fractionally out, but not by much. So there's two parallel pieces of work going on, and the only reason they're parallel is because of the turnaround time we've got to do on this. One is the logistics, and that is about seeing whether we could do a screen, whether we can source one, and where you'd put it. Let's be really, really clear here. If we did it, there would be constraints. It wouldn't be alcohol and all the rest of it. Secondly, is then actually referring it to the for the public health side of things. And this is around, absolutely, as you said, about consistency with how we've treated other events. There are trade-offs one way or the other because obviously it's an outside event. Equally, one has to consider what would happen, let's say England won, which would be fantastic, is what are the consequences then, because there's no way that any football fan is going to be seated on the ground politely applauding. And therefore you then got to consider the risk of spread in that context, in the context of the equivalent of singing and things like that. So there's two competing things. We are actively looking at it, but we want to know, A, is it advisable? Because although, as we've said, the numbers side we are watching carefully, and although, as we've said, we are, when I say comfortable, we are, we're following the data, but equally, it's what essentially things could take place that accelerate that increase, which you've got to then take into account. So that's the trade-off, and I can't yet give you an answer because obviously we're going to wait for the advice. I was going to do Ivan, then Lyndon have last word.
Ivan, I'll have the last word.
I thought
I like the last word. Yeah.
Okay. Obviously, I'd very much like England to win. I'd very much like people to enjoy the match, but I don't want Jersey to lose as a result. So we need to think about the safety measures that we need to bring into place if this event goes ahead, and whether in fact those safety measures are sufficient. So we are considering it, we are looking at, we all want this to happen, but we don't want to create undue difficulty as a consequence of that. So we are deliberating the matter.
Okay. So finally, I think what John and Ivan have just said is that the government is working with the Bayless panel and third parties, and if we can produce a safe fan zone, then it can go ahead, and we're going to make an announcement tomorrow.
Yeah. Okay. Now I can't actually see who it is on Bailiwick. So sorry, you're blacked out against the window, as it were. But anyway, so Bailiwick.
It's David from Bailiwick. Hello.
Oh, thanks.
So on Sunday, you removed isolation for direct contacts, and today you've announced there's only going to be a short isolation period for travellers that aren't vaccinated. With two key incentives for getting the vaccine gone, what's left in your armoury to convince those who are still vaccine hesitant? So, sorry, I got the bit about what's left in our armoury. What was the introduction to that? With something rather gone. That the vaccination period for those who are who haven't had their vaccination yet, the period now is only going to be a short one rather than a long isolation period. And I'm just seeing, in regards to that, what you have left in your armoury for those who are still vaccine hesitant. Well, I think if you're hesitant, I think the only comment we can keep reiterating is that vaccines are essential not just for yourself, but it's also about protecting your friends and neighbours. And that's why we actively encourage everybody who can to go out and get vaccinated. But at the end of the day, it is a matter of personal choice, and what we do, we have to consider the whole community. And given that, as we've said, it's I think it was 93%, 93, 94% are over 50s, have been have had their full vaccination. Over sort of 60% of islanders over 18, I think it's 63%, sorry, are fully vaccinated. The point is, it's about recognising that we are moving to a new normal. So the more people that can get vaccinated, the better. If people are hesitating, then actually they then start to get to that position of being, it's about personal responsibility. And therefore, there is guidance on the online, and I believe it is in the process of being updated, which will give an indication of if they need to protect themselves and don't want to protect their friends and neighbours through having a vaccine, that they will have to look at their own risk profile and how they want to go through life.
but the measures that we're putting in place are, and I would say they are effectively to date working around protecting as much of the community as possible. And I think, I don't know if we can put that that graph up with the over 18, the 18s and the that one, that in itself, I don't know, is that online as well? Just so the one before. That one. Can you see that, David? Okay, so that graph there is very much showing that the vaccine does work, that the over 60s are very much less positive in terms of now compared to the wave that we saw in November and December. There's obviously other data that's coming through about the percentage rates that apply from those who have been tested positive to those who go into hospital. If you want, Ivan can no doubt talk to you about that, but there are significant reductions in that rate that you were seeing before the vaccination process was going through compared to where we are now. So the demonstration is that it is working, and therefore by doing it by age, and we know that in general, the younger the person affected by the virus, the less impactful it is on that person. Those are the measures that we're now looking at. That give you the context?
Yeah.
Okay. Do you want Ivan? Ivan, you want to talk about for literally 10 seconds on the that hospitalisation rates change as a result of vaccination?
So the hospitalisation has reduced from using UK data from about 15% to 1.5% or less at the moment. And as I said earlier, the disease, even if you're in hospital, appears to be less severe than it was in the first and second waves.
Okay. Thank you. I think that was your first question, so do you want to go for a second?
Yes, and second question again, going to the new rules introduced today. What was the rationale for maintaining tester at the border for fully vaccinated arrivals? And do you envisage moving to a position at all where vaccinated passengers won't have to be tested at all? And will that be in the near future? When can we anticipate that?
I think I'll hand the rationale over to Ivan. It is around... as we said, it is around a simplification, but it is also around just keeping an element of control at the borders, which is also then, if some new variant appears internationally somewhere, that we are in a position to detect it. Ivan.
There is at the moment a perceived need to have some control at the border. Variants are important in that regard, and all positives picked up at the border are sent for sequencing to keep an eye on what's coming in. We also, of course, keep an eye on what's being noted in other countries, because it gives us a very good picture of the variants in other countries. In relation to are we going to continue with this forever, the answer is almost certainly not, but I can't give you a time frame for when this is going to stop. And as always, this is uncharted territory, so we're taking small steps at a time to rather than large steps suddenly.
Okay. Right. I think I get an impression that probably our friends in the media have had their fill to an extent. We've tried to keep it reasonably short, but can I just thank all the media and those watching for joining this very brief press conference today. So whilst COVID-19 remains a risk, it is one we are all slowly learning to manage and to incorporate into our lives. So as a final plea before we finish, if you are eligible and have not yet done so, and it's very apt after the last couple of questions, please register for your first dose of the COVID vaccine. It is the most effective way of protecting yourself and our whole community. And only with your continued cooperation and acting on the strong data underpinning our decisions can we maintain the good position we are in. On that note, thank you very much for listening, and we draw this conference to a close.